Right malignant cerebral infarct following a mild head trauma in a healthy child. Minor head injuries are common accidents in childhood, and they often present with normal neurological findings. Stroke is relatively infrequent in children, and post-traumatic ischemia is a rarely described event. Ischemic stroke can lead to significant morbidity and mortality and can occur at any age. The incidence is higher in children under 2 years old and decreases progressively until adolescence. The reasons why this entity appears to be confined to young children are not clear. However, the anatomical relationship of brain vessels during childhood might play a crucial role. Post-traumatic strokes frequency, cause, and influence on mortality are not well elucidated. Previously reported cases mostly describe basal ganglion infarct, so the authors present the first case of post-traumatic malignant infarct in a healthy child after a mild head trauma. This is a 3-year-old male who was admitted to our emergency room after 72 hours of a fall. No loss of consciousness, no seizures were reported, and the first CT was normal. Gradually, he developed headache, drowsiness, and left hemiparesis. After that, left face muscle contraction, nausea, and vomiting. The initial Glasgow Coma scale was 11, and he started to deteriorate. The MRI demonstrated a high signal intensity in the right middle cerebral artery territory, confirming a malignant ischemic injury. We also ran a cervical MRI, which was normal. We performed a right decompressive hemicraniectomy and an ICP monitor was placed. The patient was managed in pediatric intensive care unit and we ran a complete infection and blood panel which was normal. The angio MRI that was run at day 12 revealed no occlusion or stenosis in arterial or venous tree, which made us suspect of vasospasm versus thrombi as a possible cause. Cranioplasty was placed at 6 months of the event, and at 12-month follow-up, the child showed good neurological recovery. He remains in epilepsy treatment and physiotherapy, and currently he is able to attend regular school. Cerebral ischemia after a minor head injury is an unusual mechanism of stroke in children, and other possible causes should always be ruled out before a diagnosis is formed. The anatomical relationship between the lenticular striate arteries and the trunk of the middle cerebral artery changes from fetal life to adulthood. Additionally, gene mutations have been found to predispose to vasospasm and intimal alterations as well as some viral infections. Here we compare our patient with 2 previously reported cases comprising the ICA territory. Always try to figure it out what happened first, trauma or seizures, for example. Hair diseases, neck injuries, infections, or blood discretions should always be ruled out. Given the frequency of mild head trauma in children, the pathophysiology of cerebral infarction warrants future considerations. Hospital admission, careful observation, and early diffusion weight MRI should always be considered in mild head trauma when neurological deficits persist. Early surgery in selected cases may benefit neurological outcome. Thank you.